Today, I'm presenting the paper, Integrating a Voice User Interface into a Virtual Therapy Platform. This work is part of an ongoing study to develop COCO platform, a platform that provides caregiving support to promote the health and well-being of family caregivers. Formative research suggests that self-care tools for this group need to be on-demand and flexible for multitasking activities. Our goal is to explore the integration of voice user interfaces to improve user experience and engagement. In the US alone, there are more than 50 million family caregivers providing unpaid care to their loved ones with chronic health conditions. While juggling caregiving tasks, their own work, and other responsibilities, these caregivers can experience significant amounts of stress, social isolation, and burnout. Failure in managing caregiver stress will reduce their ability to provide high-quality care and lead to long-term harm. To tackle this problem, we propose a voice assistant developed on Alexa skill to facilitate the delivery of virtual therapy from the COCO platform. COCO Voice Assistant guides the practice of scheduled self-care activities and provides quick responses to alleviate users' immediate symptoms. Users can initiate a voice conversation by saying, "Coco, start today's session," or saying, "Coco, I'm feeling stressed." Then the user can simply follow the voice prompts to start practicing. After each practice, users will have the option to provide feedback and try other solutions. At the end of the conversation, the voice assistant will summarize the user's progress and encourage future practice. We follow the design thinking process to explore how voice user interfaces might be valuable in helping family caregivers practice self-care activities. We started with primary user research to understand issues directly affecting how caregivers care for themselves. From our interviews, surveys, and diary studies, we found that caregivers have challenges managing their own health due to significant demand on their time and lack of access to self-care resources. Moreover, caregivers have the tendency to put their sick families first and even feel guilty about spending time for themselves. Making self-care practice convenient and straightforward is essential to motivating self-care practices. With voice-based products being used increasingly, voice user interfaces might offer a more flexible channel for caregivers to access self-care support, even when they have to multitask. We conducted 3 rounds of prototype iterations and tested the overall user flow, different user interfaces, and factors that contribute to a good voice interaction experience. Here are the key findings. Most users thought that voice interface alone is insufficient for them to get a full picture of the product. A graphical user interface is preferred to help users onboard and fill the gap when Alexa devices are not accessible. As voice is a transient type of information, it's easy for users to miss or get confused by complicated questions. Balancing the level of detail and the length of dialogue is critical for making voice conversations efficient. Last but not least, we found that users prefer the sound quality and a more immersive experience of voice interaction from a smart speaker. Also, getting relevant responses are more important than providing quick responses. From this study, we identified 3 significant benefits from integrating VUIs: allowing multitask for busy caregivers, creating a more immersive environment, and enabling shortcuts to access specific functions efficiently. Limitations of VUIs include long and complicated conversations are difficult to be carried out efficiently, and current NLP technology cannot support free-flowing conversation like talking with a real person. Future work to test the efficacy of VUI integration should focus on improving the accessibility and compatibility of the voice assistant, testing effect of tone and speed, as well as conducting longer-term user testing to observe how users' preferences will evolve as they get more and more familiar with the process. Thank you.